For generations, South African women have understood that when something threatens our families, our children, and our communities, silence is not an option. In 1956, women were already confronting the damage alcohol was causing in their communities. 70 years later, that history found its voice again at the 2026 Women's Parliament. The Speaker of the National Assembly reminded Women's Parliament of the women of 1956, women who saw men spending their time and household resources in taverns while families and communities suffered. Those women did not simply accept what was happening around them. They organized, they challenged it, they acted.
Some of you might remember the women of KZN in Durban, where they went to a place where there were a lot of people, particularly men, who like to have their beers there in the beer halls as a match. They kicked those, liquor and others, but initially it was these women who, when the call for taking up arms, they did not say, Singo mama, singo no zala kumele sipheke imbiza. It is these women's struggles that actually led that social equality through the various programs that came about when we started in 1994. Today we can walk and not have secondary smoking. And we now have got spaces where we can say smoke-free zones. Comrade Nkosazana Zulu.
It carries an important lesson for us today. What society accepts as normal can change when people organize, when evidence informs policy, and when government acts to protect public health. In 2026, women were once again asking, what is harming our communities and what are we going to do about it? The conversation was clear. Alcohol harm is simply not about individual choice. It is about the safety and dignity of women. It is about the protection of children. It is about the well-being of families and the kind of communities we want future generations to inherit. Women spoke about the need to return to activism, to speak about what affects us and our communities, and to confront these challenges together and decisively.
We need to get back to activism as women. We need to understand that for as long as we are not talking about the issues that affect us, nothing is going to change.
They heard how evidence-based measures, including excise taxation, can help reduce alcohol harm.
The campaign is called True Cost of Alcohol. And what we are saying is, there is too much that we are paying as a nation because of alcohol in our country. We are having a process with National Treasury right now where the alcohol industry itself is saying that they understand the public harm that is caused by the product that they are selling. They understand the harm to the families. They understand the flooding of our streets and our communities. They also understand fully how alcohol is being sold, especially in black and colored communities in South Africa. And we cannot then allow them, having said that they understand this, but then they continue to say they still want to profit. We are saying the WHO has put in measures to say countries should implement these measures. Those measures are using fiscal policy, that is the excise tax that the industry does not.
But perhaps the most important question was the simplest. What can we do?
From the University of South Africa, I've got two questions. The first one is on alcohol. What can we do as a country to make sure that we respond to any policy that deals with alcohol?
That question followed the women from the Women's Parliament session to the dinner table. Because the conversation could not end with words, that evening women gathered with a purpose. What must change? And what should women demand from government? Around those tables, women spoke about gender-based violence. They spoke about the easy availability of alcohol in communities. They spoke about the power of taxation and other evidence-based measures to reduce alcohol harm.
In South Africa, gender-based violence is a presidential priority, and we want to show that alcohol and alcohol availability is one of the structural issues in communities that government needed to address. if we're going to change the issue around gender-based violence.
Africa.
I recently started a petition to support SAAPA in requesting the National Treasury for an increase in excise tax on alcohol above inflation. And I thought it was very important to support SAAPA because I was talking about the lack of unified youth participation in social issues that we have. And I thought it would be good to lead by example and support the...
And then the discussion moved from concern to action. From that dinner came a resolution shaped by women, carried by women, and taken forward by women. A collective call for decisive action to protect communities from alcohol harm. The women called for evidence-based measures, including the WHO safer interventions and alcohol taxation. They called for the Liquor Amendment Bill of 2016 to finally be tabled in Parliament. And they called for a moratorium on the issuing of new liquor licenses. But the resolution did not remain around the dinner table. It traveled back into Women's Parliament. It was presented, it was heard, and it was accepted into the 2026 Women's Parliament Declaration.
We reaffirm and advocate for urgent implementation of evidence-based population-level measures to reduce alcohol-related harm and stronger regulation of alcohol availability, affordability, and access. We support a targeted moratorium on new liquor licenses in high-harm communities as a preventative intervention aimed at protecting women, children, and vulnerable communities from alcohol-related harm. We endeavor to prioritize the tabling and processing of the Liquor Amendment Bill 2016 as a critical intervention to strengthen the protection of women, children, and communities from alcohol-related harm.
What began as a conversation became a resolution. What became a resolution became part of a national declaration. And now, that declaration must become action. 70 years after the women of 1956 stood up for their families and communities, South African women are once again saying, we will not remain silent about what is harming our communities. We will speak. We will demand evidence-based policy, and we will hold those with the power to act accountable. Because when women organize around what is harming their communities, they can move an issue from the margins to the national agenda. Wathinta abafazi, wathinta imbokodo. 70 years later, the spirit of women's activism lives on. The conversation has happened, the resolution has been made, the declaration has been adopted. Now the work begins.